What a pleasure it is to converse with Jessica Yamauchi, who is the Executive Director for the Hawaii Public Health Institute. I appreciate you being here so much. You know, the work you do is so important. As a nonprofit organization, how do you survive in this climate?
In this climate, yes, it's definitely an ever-changing climate, and thank you for giving us an opportunity to share a little bit about our organization. We are a statewide nonprofit organization. Our institute has been around actually for about 20 years, but we started out as the Coalition for Tobacco-Free Hawaii and have done a ton of work around tobacco issues. And about 5 years ago, really went through a mission expansion process to go beyond just tobacco. We still continue to do the work, and the Coalition for Tobacco-Free Hawaii is a large program of ours, but now we encompass broader public health issues.
The coalition had federal monies as well as state monies. Is that still part of your funding source?
Yes, so we do. We get funds now from the Hawaii Community Foundation that manages the Tobacco Trust Fund, which came from the tobacco settlement that occurred, and then we do get some funding from the state, which actually is from federal CDC funds.
When you talk about your programs, I know there are many programs there. What is a special one that's near and dear to your heart?
Our roots are in tobacco, and we still continue to do that. But we also now convene the Obesity Prevention Task Force, looking really at how to improve physical activity and nutrition. We really work on policy, systems, environmental type changes to impact population. We're not a direct service organization, and a lot of times people actually confuse us with being the quit line or providing diabetes education, but we really try to move things at a policy level to try and impact population health.
And you do work with youth, or at least, you know,
Yes.
I mean directly.
Yes, so we have a youth council, which is part of our Coalition for Tobacco-Free program. And we've been growing that for about the last 3 years now. And we recruit youth across the state, usually as young as around 14, all the way through college age. And the youth council, we work with giving them some skills and some education, and we work to empower them to move policy. And they get to choose a policy priority every year that they want to work on at the legislative level.
Working with policy can be very frustrating. You have a vision, and then it takes a long time to get things through or to have people understand really what your outcome is intended. Along those lines, what is one of your greatest successes recently?
I have to mention two. I would say our youth council experienced early on success when they really worked to raise the age of sale of tobacco to 21. And so we were the first state in the nation to do that. That was huge success. Normally bills don't pass that quickly. So that was early success. And then that followed 2 years of not being able to pass their next priority, which was prohibiting smoking in a vehicle when a minor is present.
All right.
But just this week, they did get to move it on a city level. So City and County of Honolulu just passed it, and the mayor signed it on Tuesday, and it went into effect. You keep at it. A lot of times you don't succeed on the first try, but we keep pushing, we keep educating, and every time you get to have that hearing, it's an opportunity to educate more people on the issue.
I remember when I was in the legislature and there was conversation about flavored cigarettes being legal for minors, and that didn't go anywhere.
Right, and so federally, cigarettes are no longer allowed to be flavored. However, other tobacco products and e-cigarettes, where we've really seen a youth uptick in usage, do allow flavors. And that is something that we are now starting to see other cities across the country start to really push. We're looking to see if that is going to be an endeavor for us in the near future.
Well, all the best for your efforts, and thank you for being where you are.
Thank you so much.
We've been chatting with Jessica Yamauchi, who is Executive Director for the Hawaii Public Health Institute.